And we continue on Newsmaker now with St. James CEO Bryan ODonovan. Bryan, thank you for joining us.
Yeah, thank you for having me.
Well, Bryan ODonovan, COVID-19 seems to be calming down in the Hornell area. You get into a new hospital, and as you know, at the same time that you do your move at St. James, the COVID thing was at the height, at its peak of cases, and wondering how are things as things calm down at the hospital. It must be almost a transition, just going into normal, which is, we were in that new normal situation for a while.
Well, yeah, that's a great question. So, moving a hospital in the middle of a pandemic is definitely something I don't recommend. Our team really did such a phenomenal job pulling it off. And now that the COVID-19 has calmed down a little bit, the flattening of the curve, and it's more longitudinal than it has been in the past, we're actually now seeing a huge increase of non-COVID patients. My emergency department, Dr. Robshaw is on today, the attending, and every bed's full. In our inpatient unit, every bed's full. And so what we're seeing is the community come back for health care that they really have needed to be seen previously for. So this is a good sign, because we really want to be able to treat this community, get them discharged, and get them healthy. So overall, I think we're seeing exactly what we were optimistic about, is flattening the curve, but then getting back to being able to treat patients for healthcare conditions that they're experiencing.
Kind of touching on something you said in your answer there, Bryan ODonovan, how are things in the OR and the ER, the operating room, and the emergency room?
Yeah, so the emergency room over the past week has been very busy. As you know, we've added new providers, new physicians on as well, and it's going extremely well. Adding also a new footprint compared to what we had at 411 Canisteo Street, and clinical equipment, the efficiencies are that much greater. So, the time to check into discharge has improved significantly. In terms of the OR, as you know, Bryan, on our weekly calls, we've been able to open up elective cases about 2 weeks ago. Our ORs are busy from the time we open, from the time we close. We still do emergent cases as well. But we're seeing a big uptick in surgeries and procedures, which, if you think about it, you think about a colonoscopy that you weren't able to have for 2 months, and if something does come up during the screening process, we want to be able to connect that patient to be able to seek further treatment, to have a quality and a good outcome. And so now we're getting those screenings through, as well as women's imaging for breast screening as well, and biopsies. So we're really on a positive track. I will say, a lot of the things that we've done with healthcare redesign, and what I mean by that is we can't go back to putting patients shoulder to shoulder in our waiting rooms. So we've gotten very creative. We've used telehealth where we can. Our primary care practices, Dr. Ashdown, Peterson, and Nazareth, have done just a fantastic job with extending telehealth via Zoom. So we are able to see the patients that need to be seen, but also we're adhering to precautionary measures such as universal masking, as well as social distancing, etc.
You mentioned cancer there in your answer. Be interested to know, were any cancer patients affected by COVID-19? Are you aware of any of the cancer patients catching COVID-19, or maybe not cancer, but another chronic type condition?
So from a national standpoint, I don't know the numbers, Bryan. I will tell you, I'm on a call every day with the university, and that is something that's been paid attention to very closely. Golisano Children's Hospital, as well as Wilmot Cancer Institute. I don't know the exact numbers. I do know all the precautionary measures that Strong in the U of R system has implemented, 2 months ago. Has really paid off. But that certainly COVID-19, when you already have potential other comorbidities, COVID-19 certainly it could wreak havoc on somebody that is immunocompromised.
Talking with St. James CEO Bryan ODonovan, this is kind of an off-the-topic question, but just kind of curious. they had the helipad at Canasteo Street for the patients that had to be transported to Strong or elsewhere. Mostly Strong, I would think, in urgent situations. How does that work in the transition from Canasteo Street to North Hornell? Did you move the helipad? Did you build a new one? Just kind of curious.
Sure. So yeah, we work with the FAA. We built a new helipad that is actually adjacent to our emergency department entrance, our EMS entrance. And so now previously it was actually out front of the administration building. The location really wasn't that logistically efficient to get patients on the helicopter and transported out. Now it's all at ground level, and so it's definitely much more efficient and much more expeditious in terms of getting patients out.
That's very interesting. St. James CEO Bryan ODonovan, we hear the word healthcare redesign these days. I think that's a phrase coming out of Albany. What is healthcare redesign?
Yeah, so healthcare redesign is something that I previously alluded to. We have to look at, from healthcare systems nationwide and international as well, how are we scheduling patients to make sure that we are adhering to social distancing so infection is not spread. And so what I mean by that is, 2 months ago, other than maybe some oncology centers and heart transplant centers and some of these others where patients are immunocompromised, you're not seeing patients or staff walking through halls with masks on. That's certainly one thing that's very different. Another thing that's also very different is the social distancing. And what I mean by that is I'll take, physical therapy is a great example of we have 3 physical therapists here as well as assistants. And so what we would do is, schedule these appointments somewhat on top of each other because they could see the different physical therapists. Well, you can't do that anymore because you don't want these patients shoulder to shoulder in check-in. So another area that we've done in all of our ambulatory clinics, when the patients check in, we immediately room them. So we're trying to isolate the patients. We're also making sure that during this pandemic that we're protecting our patients, so universal masking, as well as our staff, and then certainly the adequate and the appropriate use of PPE. So healthcare redesign really is looking at how do we move forward with providing the healthcare services this community needs in a very safe manner. Does that answer your question?
Yes, thank you for that information. Bryan ODonovan, St. James CEO, is our guest in this segment. And wanted to ask you, earlier on I meant to ask you at the same time I was asking about the OR and the ER, how are things going with elective surgery now that that's back?
We've been very busy. Initially, and it still happens, the community, this is still a very real, COVID-19 is obviously a very real virus and a very real threat. And so what we've done in all of our practices with the OR or procedures, and that includes stress tests and others, we're doing testing 3 days in advance, 72 hours in advance. We're doing COVID testing for all of those cases. And if you come back negative, then obviously we'll continue. But we are also looking at if you come back positive, and it's truly elective, Brian, that what we're doing is it's probably best that we don't do that. We'll get you rescheduled as soon as you're COVID negative. This, though, does not impact, let's say there's an emergent or urgent surgery, we treat those patients that they would be COVID positive because we would not have the results. It takes about 8 to 12 hours to get our COVID results back. And so we're still doing those cases, but we're just gowning everybody up as appropriately, as well as the patient, to make sure that if they in fact are COVID positive, that we take all the precautions necessary and we still get the case done and get the patient on their way to a healthy outcome.
You have a new pain management doctor. We got a statement about that in the last 48 hours from St. James Hospital. Did you want to talk about that a little, Bryan?
Yeah, so Dr. Gabriel Yakov has quite an extensive experience, and for pain management, this could be for patients that have just been dealing with pain for 15, 20 years. that really want to get some relief, as well as other procedures that can be done to alleviate some of the pain. So I think when you look at a community as this, and blue collar, as well as the white collar community, to be able to have pain management right in your backyard, and to have somebody that is specifically trained to be able to assess exactly what you're going through and what the patient is feeling, and then identify what is the best appropriate treatment for that patient to move forward, and hopefully get the patient much more comfortable than they have been in the past.
Do you ever get younger people? I'm thinking, the young athletes in a situation where they undergo any kind of pain management after an injury on the field or the court?
So there is pain management for that piece. Usually those patients are treated through orthopedics.
Okay.
Depending on the extent of the injury. But usually, orthopedics also has, at the university, also has a pain management component, as well as neurosurgery. And so usually you would have those younger athletes treated through the orthopedics pain management program, because certainly you want to be able to assess from an orthopedic standpoint, what's going on in terms of sports injuries and that type of thing.
Sure thing. Final question for you, Bryan ODonovan, St. James CEO. Phase 1 of the reopening this weekend. Did you have any thoughts there for those who are in manufacturing, retailing? The list goes on and on. Fishing, farming.
Absolutely. Excitement really. These folks are absolutely ready to get back to work. I'm confident that these businesses, these farms, larger businesses, manufacturing, have processes and protocols in place to be able to protect these employees. But I'm excited. I hats off to Congressman Reed for all the work that he has done, as well as these economic redesign teams, and the city of Hornell. I know they've been very very collaborative with this approach as well. So just be safe and be smart, and I think this is a really good thing to start opening things back up. And get people back to work.
Bryan ODonovan, with that, we have to let you go. I want to thank you so much for coming on.
Thank you for having me, Bryan.